אוקיי, היי. אז היי לכולם. אנחנו ממש שמחים שאתם כאן איתנו, בטח אחרי התקופה הסופר מאתגרת שהייתה לנו, אז אנחנו נורא שמחות לחזור לסדרת הוובינרים שלנו לרגל חודש המודעות. אני אלה וייס, אני מנכ"לית ומייסדת שותפה של עמותת אגם לקידום המודעות לאהלרס-דנלוס בישראל, והיום אתם כאן איתנו בוובינר על בעיות במערכת העיכול וטיפול בתזונה, ב-EDS והפרעות גמישות יתר. תעביר את הוובינר לורנה ריין. לורנה היא תזונאית מוסמכת ומטפלת תזונתית מלונדון, היא מתמחה בטיפול תזונתי לתמיכה באנשים עם EDS והפרעות גמישות יתר, בדגש על בעיות במערכת העיכול, עייפות יתר ובגישה מולטי-דיסציפלינרית מבוססת מחקר. בנוסף לזה היא גם חברה בצוות המחקר והטיפול בבעיות גסטרו בעמותת EDS הבינלאומית, והיא מגיעה לתחום ההתמחות שלה מהיכרות אישית כמישהי שמאובחנת ב-EDS מסוג גמישות יתר, עם התמודדויות בתחום של גסטרו, דיסאוטונומיה ובעיות שריר שלד. והיא מטפלת בקליניקה שלה בלונדון ואונליין. כמו שאמרתי, אנחנו נקיים בחלק השני של הוובינר, בחצי שעה השנייה שלו בערך, יהיה חלק יותר פתוח של שאלות ותשובות, שלפניו תהיה הרצאה, ואתם מוזמנות ומוזמנים לכתוב את השאלות שלכם בצ'אט ללורנה, ואנחנו בסוף החלק של ההרצאה נעביר אותן אליה. אם למישהי יש שאלה ואתם יכולות לכתוב אותה באנגלית, אז אנחנו נשמח, זה יקל עלינו, וכמובן שהוובינר גם יוקלט ויעלה לערוץ יוטיוב שלנו בהמשך. אז אני אעבור עכשיו לאנגלית. אז good evening everybody, I am Hila Weiss, I'm CEO and co-founder of AGAM, which is the Israeli EDS Society. You're here with us tonight on a webinar on gastrointestinal problems and nutritional therapy in EDS, which is given to us by Lorna Ryan. Lorna is a registered nutritionist and lifestyle medicine practitioner specializing in supporting people with hypermobility. She has a particular interest in gastrointestinal symptoms and chronic fatigue, and is committed to a multidisciplinary evidence-based approach. And she is also a member of the Diet and Nutrition Working Group of the International Consortium in the Ehlers-Danlos Society, and her special interest comes from personal experience as an AGDS patient managing gastro, POTS, autonomic dysfunction, and musculoskeletal issues. She practices in her London-based clinic and online. So Lorna, thank you so much for being here tonight. We really appreciate this opportunity, and the floor is all yours.
Well, most welcome. Thank you for having me. I'm quite looking forward to speaking to you all today. So thank you for that introduction. Obviously, quite a lot of it I didn't understand. So I have now got the capacity to share my screen, haven't I? So I shall, let's see.
Great, we see it.
Perfect. Right, let me just set this up. Wonderful. Now, I'm not very good at technology, so you'll have to excuse if anything goes wrong, we'll just talk over. So what I want to do today is just present a few slides that's going to give you some of the background to the gastrointestinal symptoms and how the body works. And then I want to have a really good Q&A and answer any questions anybody has. So I'm going to start off. I know Hila's done a lovely job of introducing me, but I want to introduce myself a little bit more in depth so that everyone knows who's really talking to them. And I always like to explain, you know, every bit of me, of who I am, because I'm not just a nutritionist. I have got HEDS patient hat on, and then I've got a specialist clinician's hat on. And so I feel I'm sort of well sat to have empathy and understanding of symptoms and also the journey to health and navigating this web of EDS. So on one side, you can see the list, I don't need to read it out, of all of the different diagnoses I ended up with when I was chronically ill, which are still, you know, factual, but I'm well managed now, so I don't have too much ill health. But I've, you know, my to share, I had 3 years of living off complete liquid food prescribed by my doctors and dietitians, and was going to have a tube fitted. So that is where my passion for gut health and let's, you know, get everything working as well as we can so we can eat our food that we love, that's where it really comes from. And then over on my specialist clinician side, I have quite a few different things behind me. When I'm delivering talks, I'm a registered nutritionist. If I'm one-to-one in clinic, I have the nutritional therapy practitioner hat on, and that's just looking purely at the body and nutritional science. And then I'm a registered lifestyle medicine practitioner, and what that means is that I have additional tools in my toolbox, and in that we look at other things like sleep, relationships and movement, and then how the relevance of that multidisciplinary team and how everything goes into your lifestyle to support you. I'm functioning medicine trained as well, so I look at the whole body together, not just one bodily system at a time. So in that, although my specialist geeky area is gastrointestinal, I'm also looking at what's happening cardiovascular, what's happening in your mind and your mental health, what's happening in urology, etc. I've gone through many sessions of the EDS Project ECHO, and I'm an alumni with them, and I'm a member of the EDS International Consortium Diet and Nutrition Working Group, as Hila said. And in that, we're a small group, international, so it's mostly UK and America, and we're dedicated to researching diet and nutrition interventions for a positive impact for people with EDS. So it's slow go as research goes, and we're only sort of getting to some fruition at the moment, but it's a very interesting element to be working in, and it goes to show that we've got, you know, doctors, dietitians, nutritionists really looking into this for people, the EDS population out there. And as Hila explained, I specialize supporting hypermobile adults, and then my specialist area is gut health. So I want to bring it right back to the beginning of what is Ehlers-Danlos syndrome, because in my experience as a patient and a clinician, sometimes people aren't too clear. They have a diagnosis, they may have done research. And for those out there watching part of the Healers group, apologies if I'm not pronouncing your name right as well, Hila. You're probably more educated than maybe other people, but it's important to realize that yes, it is a connective tissue disorder that may be genetic. We know that about many subtypes except hypermobile, and there's research going on at the moment of whether it's genotype or phenotype, and epigenetics of whether it may be acquired and triggered through dietary, lifestyle, etc. And we know that the effects of your connective tissue in EDS is that the structures that make up all of the tissues everywhere in the body, as you can see there, the skin, bone, joints, I don't need to read it out to you. But what it means is there's just some defects there. So your body might have a little bit of trouble formulating your connective tissue nicely. What's important to remember is that Ehlers-Danlos is not an autoimmune connective tissue disorder. And this can be confused when people Google what connective tissue disorders are. That would be something like lupus, where it's acquired and it's an autoimmune disorder, and you are able with medical support to treat that. Obviously, EDS at the moment, there is no so-called cure medically. And it's also important to remember that EDS does not arise from anything you may have done with your diet. So if you have been deficient in nutrients for whatever reason, you have not caused your EDS or hypermobile EDS, because you know there's not a genetic test for hypermobile. And sometimes in my experience, people feel that if it's not genetic, have they caused it? And that's not what we can say. So that outlines exactly what we're dealing with when we talk about Ehlers-Danlos syndrome and connective tissue. So we're going to dive straight into how EDS might affect our digestive system. Because we have connective tissue everywhere, our digestive system actually goes from our mouth to our anus, and it's all tissue that can be affected when your connective tissue isn't working quite well. So you can have a range of disorders. Dysmotility is one of the most common, and that's a dysfunction of the muscles that literally squeeze food through, and then when you need to use the bathroom, that's that involuntary muscles that's happening to push everything along nicely. And then we get into the functional gastrointestinal disorders, which I know from Hila that a few of you are interested in, so we're going to dive in a little bit deeper there. Also, your autonomic nervous system can be dysfunctioning. This is because your nervous system somewhat is controlled by your gut, and we're going to talk about that as well, because it's a really interesting area to understand if you want to understand what's happening with your gut, if you have POTS as well. And then dysbiosis literally means your gut bacteria. So somewhere along the line, you've become a little bit too happy and excited on the bacteria front, and you've developed dysbiosis. And then nutrition deficiencies is quite common. So it's still out with the science of why does having EDS put you down to having nutritional deficiencies, and it's mostly because of poor absorption, but we don't have a definitive answer. And when we need to look at what's happening with our gastrointestinal tract in order to understand what might be happening for someone with hypermobile EDS or classical EDS. And I say those two because I'm not including the rare types like the Marfan's and the vascular, because that's not an area I specialize in, and it's going to be far more complicated. So we sort of have to wind backwards to what exactly is going on in the body before you can understand how you eat affects it. So I'm hoping all that makes sense. I can't actually see many faces, so I'm hoping everyone's smiling along. This is the digestive system. If you can put that image on your own body to get a good idea of where these elements are, then it's really helpful when you start to think about what symptoms you have. So the digestive system starts up here. Let me put my laser on. Here in the mouth. Chewing is the very first part of the digestive function. We then go down our esophagus. We're then going into the stomach here. This drains down into the small intestines and then whirls all the way around this big long tube, the large intestines, to the colon, into the rectum, and this is where we will be excreting our stools. So sometimes if you're reporting bloating, it's quite helpful to think, is it up here, like just if there's ladies, like where the bra strap is, or is it lower down on the left or the right? Because as you can see, it gives us an idea of where our organs are. And I'm not sure if any of you have been to your gastroenterologist or other dietitians, and you may have had this conversation with them. So, where's my button? So once we know what's going on in the digestive system, where our different stomach, intestines, etc. is located, when we're looking at EDS, hypermobile EDS, and gut health, and also comorbidities, we need to drill into this wonderful little system called the gut-brain axis. So this is our gut, our stomach here that we've just seen, and this is the top of the large intestines. And this up here, if you can see my lasers, our brain. And this long nerve is the vagus nerve. And what that is like the telephone call from gut to brain. So they're talking all the time. So there's so many neurocommunications happening and hormone communications happening. Why it's really important to understand this gut-brain axis is because dysfunction here is where our comorbidities occur. Lots of people with EDS and hypermobile EDS that also have gastric function disorders do report things like anxiety or brain fog or general fatigue or stress. And the gut bacteria that's sitting all down here in your intestines has a direct impact to your brain. And then likewise, your brain will have a direct impact down into the gut. So if you're stressed and in pain, it might impact what's going to be happening on your digestive system. So normally I ask for people to put their hands up to just make sure that makes sense before I move on. So I'm hoping everyone's good. Pop a question in the chat if you're like, what does that mean? And then we'll recap later. So let me just go back, sorry. Here, where is it? Here, this area here is where we're going to drill into a little bit more because it's very important for us hypermobile folk. So that little top of the intestines, it goes all the way around as you saw in the first picture. This is microscopic zoomed in. And if you see where my laser is here, now, if any of you out there are really geeky science, you'll love this. If you're not, just look at the pretty pictures and hopefully between the two of them, you'll get the message that this area has tight junctions, which is made up of connective tissue And it is the most important thing to understand and look after when you have EDS, when you're going to be talking about what food might help you. So what this is our lumen, which is like lots of tissues. Here where my laser is food inside the intestines where it should stay. Up here is our brain, and we've got our vagus nerve, which is that communication. Now these, on this side where my laser is, hopefully you can see it, there's little tight junctions, and they keep all the cells nicely butted up together. And that's how it should be, so that everything inside the intestines stay there. What happens, for numerous reasons actually, not just EDS, stress, alcohol, drugs, like medication drugs, not recreational, lots of reasons happen to increase intestinal permeability. But what we know about someone with EDS and hypermobile EDS is these connective tissue tight junctions can become slack and loose and damaged. And then that allows a gap to become in these cells, actually in the wall. And what that does, which is not friendly for us, is it allows little microscopic elements of our food waste to pass through into our body and mix with our immune cells. And that's not necessarily helpful for us because it's not meant to be there. So this is where you get things like food allergies, mast cell symptoms. So when we talk about mast cell, we're not talking about the activation syndrome where you would have a blood test, you'd have a marker, and you'd need to see a specialist. This is the sort of the mast cell reaction. So the flushing, anything that feels like a histamine response. Also fatigue, inflammation, pain, it all happens once our food particles come through our tight junctions into our body. And then you can see all of these chain of events that happen. I won't go into the exact science of like the pro-inflammatory cytokines, etc. But these are what can stimulate more of the anxiety in the brain and the vagus nerve communication. There's so many neurotransmitters and cell signaling and hormone signaling that goes on that as soon as food passes through, your immune cells go rah, your cytochromes go rah, your vagus nerve is going to be giving messages to the brain. And all of this can then lead to some symptoms, which we're going to discuss. Here, functional gastrointestinal disorders. Now, I know it was one of the questions from the members. Sometimes it's very unclear, what does that mean? You know, you may have spoken to a doctor and you may have seen on your paperwork that you've got functional gastrointestinal disorders. I'm not a gastroenterologist or a doctor. So for the actual fundamentals of the medical side of that, that would be better placed with a doctor to speak on it. So I'm going to be speaking from the nutritional point of view of knowing physiologically what happens. What we know about functional gastrointestinal disorders is that they are persistent symptoms. So it might be something like the bloating, the nausea, the reflux, the constipation, and it results from your dysfunction of the GI tract. And they're not caused by biochemical abnormalities or structural deformities. So if you went to your doctor and you had like a colonoscopy, everything would look lovely. You won't have, you know, blockages, you won't have skin folds, you won't have anything that shouldn't be there. The three main features are motility, which is the slow of the, as we said at the beginning, that smooth muscle. So I use my hands a lot. Apologies if it distracts anybody. So you've got that motility, the smooth muscle function, the sensation, which might be feeling of fullness, feeling of pain, feeling of cramps, and then the gut-brain dysfunction, which is depicted in this lovely man. So it feeds back to the images we've just looked at of the gut-brain link. So it's the brain and the gut talk, then the gut and the brain talk, and then the gut speaks to the brain, and then you're in this continuous loop. And this is where the gut-brain dysfunction comes from in the functional gastrointestinal disorders. So this is quite often, if you have a picture of gastro issues, shall we say, and they could be very widespread, you may also have feelings of anxiety, feelings of fatigue. So they're all tied in there nicely. It actually tends to be more common with hypermobile EDS, and studies do suggest a link with POTS. So if you have had a diagnosis for POTS, quite often you'll have a higher incidence of these functional gastrointestinal disorders, back to really the autonomic system, because the gut and the brain talk. So at this point, I'm hoping the big message you're taking at the moment is that the gut and the brain communicate all the time, and it's really important for hypermobile people. Now, this is the lovely stomach emptying issue that some people have, and it's important to touch upon it from a nutritional capacity, not a medical capacity, because it helps you to understand what your body is doing with food, and therefore what might be happening not necessarily normally with food in someone with hypermobility or EDS. So this is the picture of our stomach. So if you remember from the first diagram, it's the one that sits up near the bra strap or under the pecs, if there's any chaps listening. So you'll be chewing, the food will come in, land in the stomach. If you've just had a liquidy meal or a glass of water, it might sit here low. If you've had a solid food, imagine like a nice stew or beef burger or something, it could come, fill up quite high. The body will just sit with it for a while, and the brain will be like, oh, you've got food in your stomach, what we're going to do. And it will have a little bit of a to and fro for about 10-20 minutes. And then it will decide, what should we do with this? Normally, it will be, let's excrete it down through into the intestines. And so our normal timings is here on this diagram. The red is liquid meal. So at about 10 to 20 minutes, your stomach's going to start going, come on, move on now. And you'll be emptying your stomach. And so you can see that emptying will happen quite quickly because it's liquid. And at 2 hours, you'll have no liquid left in your stomach. With a solid meal, for someone that does not have any problems, it'll all be here, and the stomach will be excreting lots of enzymes to digest it all, and it will be like emulsified and mashed up like a NutriBullet. And then it will decide to start emptying. Usually it will sit there for a while, and then slowly it will empty. So you see it's a nice line down, and at 2 hours you should have no food left in your stomach, and your stomach will be empty and it will be ready for your next meal. Now, where are we up to the top? If you remember, this will be going up into the esophagus and then to our mouth. Many things might have happened to mean that your stomach hasn't emptied, ideally, without you having a problem. You might not have chewed very well, because chewing's that first process, and it actually gives the body signals for those digestive enzymes. So sometimes even just chewing more thoroughly will help your stomach to empty. But if you've got any kind of dysfunction with your whole gut-brain axis and communication, or the motility through those tubes, your food might slow down. Sorry, that's the word. Your food might slow down as it enters. And some people might have a stomach that doesn't empty for 4 hours. If you then go and have studies done with your gastroenterologist, and they'll actually, you'll swallow some food with a little camera, or however they do it, there's a few different processes according to what country you're in, you might be able to get an actual reading for yourself. So sometimes that feeling of fullness is literally the food has sat there for too long. So that's the normal parameters. So it's helpful for you to think, when I eat a full meal, how long do I feel full for? Excuse me, and that could give you an indication. Oh, it's not moving. There we go. So that's the stomach emptying, and now we're going to bypass the intestines to go right down to the action end of the bowel motions, of what makes you then pass through the waste. And it's important to really understand what's going on here, because some people, they feel that they need to go to the bathroom a lot, or they feel that they need to go after food or quite urgent. And so understanding what's really going on is going to help you, kind of keep a diary of what might be problems for you to then report back to your medics, and also to tie it in with times of stress or what food you've eaten. So we've got another lovely diagram, which is looking at the gastrocaloric reflex. It's a word I'm not very good at saying, I'm afraid. And literally this reflex controls when you open your bowels, and it talks to your brain. So we're back to that gut-brain axis. And it's a normal activity after eating food. It's literally you've excreted your waste through your stomach, intestines, liver, etc. It's ended up down here, if you can see my laser, collected as feces. Now, cell signaling that happens there will literally be talking to your brain saying, is it safe to go to the bathroom? Your brain might say, oh, no, she's on a train. So then they'll go, okay, well, hold on. Or the brain might say, I'm not happy here, get rid of the waste. And then the gastrocaloric reflex will say, okay, we'll send messages to get them to get a wriggle on. And that's where you'll be like, oh, suddenly I need the bathroom. So there's this cross communication happening that doesn't always fit into our happy day, which is when this is really when our quality of life can be affected if we feel that we need to use the bathroom far more than what's, acceptable for your own daily living. It is a normal activity to food. This process can be sped up by stress and anxiety, and also food intolerances and allergies. So this is why it's important to keep a food diary of food you eat and how often you open your bowels if you feel you've got that urgency. It can also be slowed down by stress, and it's super influenced by the gut microbiome. So I'm going to be like a broken record, but it's back to this gut-brain axis, and it's back to the gut bacteria living in our intestines and how it does control many of our functions. And I hope everyone is happy to, I know we're not going to discuss it, but happy to be looking at the Bristol stool chart. Apologies if it's going to embarrass anybody, but it is the most important thing you should become familiar with if you have hypermobile EDS or EDS with gastrointestinal dysfunctions, because it tells you a lot about what your body is doing. So there isn't necessarily like the perfect type every single day, because we're not robots, we're humans, and every day we eat different foods, we sleep a different amount, etc. Ideally though, we're liking type 4 or type 3. If you're passing type 1 or type 2, that can indicate you're more dehydrated and potentially your body needs more water, or it needs some more fiber to help bulk up the stool. And it also might signal that you have some slow motility so that you're not able to flush through your feces as quickly as ideal. On the other extreme, if you've got watery solid, that's potentially infection. If it's fluffy or soft blobs, really what's happening here is it's bacteria you're passing, it's waste from your blood that you're passing, it's what's happening in your liver that's coming out in your stools. So it might indicate how well your liver's working, or just how well your gut bacteria is working for yourself. So if someone came to me in clinic with type 5, I'd be like, okay, I think your gut bacteria might be struggling here, and we need to be really assessing what you're eating and your level of stress. So I shall move on from our lovely diagram. This is where comorbidities come in, and I've put a spider web image because it literally is like a spider web. If you remember back to our intestinal permeability image of those food particles coming through into the bloodstream, our immune system is activated. This is where you can get your comorbidities that present as immune dysfunction, as your allergies, as your food intolerances, mast cell, and then POTS, because our gut brain are talking to one another. And POTS is autonomic nervous system, and the gut can control the nervous system to a degree because of that vagus nerve. Gastroparesis is one of the biggest comorbidities that can present, and it's really quite difficult to isolate the one thing that might be causing that, but we know that it is is completely impacted by the vagus nerve, and you can really get into the nitty-gritties of the gut, like the migrating motor complex, that are literally little guys that sit on the, like, microscopic, that sort of crawl along and clean and everything. And it can also just be stress, because stress's impact on the brain through the vagus nerve will just stop that motility. And then IBS is a very common thing, and a lot of people get diagnosed with IBS and they don't know why. And really, when you have a good clinical work through, you can sort of pick out what's going on with the gut when you're looking at the food that you eat, and unpick why that might be happening. So this is just going to be quick fire through, because then I want time for questions. So we've kind of done our lovely diagrams that I wanted you to really pay attention to. So this is just why diet and nutrition is important. It's because whatever you eat and absorb will support your gut microbiome, those bacteria. It will support that intestinal gut, the gut barrier function, which is your intestinal permeability. And then it will support your immune health. You have to ensure nutritional requirements are met, just as a human, just for health. So that's regardless of whether you have EDS or not. Just to be a healthy individual, you should have adequate nutritional intake. And there are some nods to some extra things that we need to be mindful for with EDS. Having the right nutrition going into your body is going to serve your digestive functions well, because it's going to be feeding that gut bacteria and those immune processes. And it will support the gut-brain axis because of how food is supporting the bacteria, which then supports communication through our neurons, and lots more, which I'm happy to answer questions on. Whoops. It's not clicking on, is it? And so I want to touch on the nutritional sciences. Where are we with evidence? Like, what does the science for nutritional interventions or protocols tell us about EDS? Well, despite what you might read online, there is no established diet recommendations for EDS yet. In our consortium, that's what we're working towards. And Professor Aziz at Bart's Hospital has got a study underway looking at evidence of whether diet does positively impact. Both of those results is going to be, a year plus, but we're looking at it. But as yet, there absolutely is no one diet that is going to improve your symptoms or, suddenly make you well. There's no dietary recommendations that are, general, so everything has to be personalized. If you are going to make dietary changes, because on one hand it's so simple, food is just general, but on the other hand it can actually change so much in your body that it must be taken under clinical supervision if you're coming from a place of being unwell to start with, so your health is unstable and maybe you've got medications. And then it doesn't really matter what you eat, it matters what you absorb. So if we go back to that diagram with that intestinal permeability, you're not absorbing food there, it's going through into your blood system. So it matters what you're capable of absorbing and those nutrients it's going to then go in for building blocks. So as I said, there's no one single diet or type of food or fad that will help your health outcome. And I know, because I do actually routinely Google what's the latest thing that people are saying. There's a lot of bloggers and things out there that will say, high B-vit supplement or a vegan diet or only have whole foods. That's just myth. That is not proven in science. Even if you look at general population of people that are well, there's no science there. If that was the fact, every vegan on earth would be like amazingly healthy, no cancers, no poor dysfunction or anything. So that is not scientific. There's no evidence in that at all. But what we do know is evidence of general population, and then translated over to what we know about EDS, is that making dietary choices that improve your nutritional status, your metabolic health, which is how you use your fuel in your cardiovascular, and your digestion will positively impact your symptoms. And we know that because every clinician working with people see it in clinic. So it's sort of anecdotal on a huge scale. So Now we can come on to nutritional guidelines for EDS. So we say guidelines because we know in clinic that it's safe, it's measurable, so that we can literally track people. And we know that it does, have that positive impact alongside other things. So it's in that multidisciplinary approach. And excuse me one moment. And it's looking at what we know scientifically about how nutrition works in the body. And so for EDS, we know that nutrition is going to give you all of the building blocks your body needs for its structure, for its hormone functions, for its neurotransmitter functions, and fuel. And this is a very important thing to be very mindful of when we're talking about nutrition, is that nutrition, the term, doesn't just mean food. It's not just what have you had for dinner. It's your dietary intake foods, your drinks, your supplements, your digestion, and your absorption. So your nutrition is your absorption. So it's what has the body actually processed. And to give you an example, if you have a source of protein, whether it's meat, chicken, or say plant tofu, if you have not broken that down well and absorbed the little microscopic compounds from that for building blocks, it will go through and it will be part of that lovely stool you'll produce. Even if it's type 4 and it looks lovely, you might not have absorbed as much of those amino acids in your protein for building blocks. And what we know about our nutritional guidelines with gut health is that you want to support your gut-brain axis through your nutrition, and you want to support your gastrointestinal functions through your nutrition. And you can see there I've repeated it because actually, it's exactly the same. It might just be tweaked, but it's the same message. It's water, it's protein, carbohydrates, fiber, lipids, which are your fats, your vitamins, your minerals, your prebiotics, and your probiotic foods. And that is what constitutes a balanced nutritional intake. And we can get specific. Now, I am not the type of clinician that has set protocols of you must never have this and you absolutely have to have this every day. I like a general. And when you are coming from a place of gastrointestinal dysfunction or poor health, it can be really taxing to think about what vegetables am I meant to eat? And what we know about the science of food is that it is not one thing, it's not one food, it's the array of food, the diversity of food. So we'll start with the reducing side. I'm just going to check the time, I'll speed up. So what we want to reduce, because we know it may have a negative effect on your gut microbiome and that gut-brain axis, is refined carbohydrates, which is your white pasta, your white breads, confectionery. Fructose, we want to limit to 25 grams a day, sorry. And this doesn't necessarily mean you can't have fruit. It's just, if you will look at ingredients and it's got fructose syrup, these sort of high fructose amounts, because it can be quite degrading for our gut bacteria. The same as the sugar substitutes. It's quite hard for our gut bacteria and our liver to process through. And people might be surprised to hear that actually, if you want something sweet, just have normal sugar, because your body knows it and it will use it nicely. And it actually gets processed in an area of the intestines that it's meant to, whereas some of these sugar substitutes will be they'll be tried to be processed in a different part of your intestines that may cause bloating, because the chains, it's it could get into the science of the number of chains of the sugar polymers, but they get broken at different places in your intestines. So limit your sugar substitutes. Artificial colors, preservatives, stabilizers, emulsifiers, again, can aggravate your gut microbiome. Saturated fat is just general health. We're not talking about the saturated fat you might get on a lovely slab of beef if you consume red meat. We're talking about those pastries, that confectionery, the sort of high trans saturated fat. And then alcohol, because it's from many functions, even from just your digestive enzymes and your stomach acid, right the way through to your gut bacteria in your liver, alcohol can be negative. So what we want to do over on this side is increase everything that's colourful. Because if you think of a food as what does this food have in it, it's going to be having your vitamins, your nutrients, your antioxidants, your minerals all bound up into one little parcel. So you haven't got to think, what's got my B vitamins in, what's got my zinc in. If you generally look at your food through a course of a whole week and it's very colourful, then you will be getting those nutrients in. So we want to prioritise our fresh fruits and vegetables. So that's leafy vegetables, root vegetables. We want to be going for things like ancient grains, like our buckwheat, millet, and even whole grain wheat if you're consuming gluten. I haven't specifically isolated gluten, like the to eat or not to eat, because it's a huge debate. The science isn't clear, and it can be beneficial for some people to eliminate it if they have specific issues. So I am happy to answer questions on that. But really, the topic of to or not to eat gluten should be that personalized, sort of more clinical discussion according to your symptoms. Because if you exclude it, you're excluding an awful lot of vitamins and nutrients. So as a just general, we like to include it. Then our legumes, our beans, our lentils, nuts and seeds, olive oil, lean proteins. Now, I've got a little unless SIBO here on the prebiotics, because onions, asparagus, chicory root, other things that are very high sources of prebiotic foods, which mean that they feed our gut bacteria, are marvelous unless you have a medically diagnosed case of SIBO, in which case they're your worst nightmare because they will ferment and you'll be in agony and cramped, and so stay away from those. And then hydration, which is paramount, but it's not just about guzzling water. It's making sure that you're drinking water in a certain way that is hydrating you, so that if you're thirsty, have a good old big glass of water rather than sipping. And I didn't want to touch too much on the amounts of water because we're a group of people with EDS. And so there may be people in the audience that have got POTS and will have different needs for their water consumption, or on medication and again have different needs. So the general rule is your urine nice pale straw colour? If it's dark, either speak to your doctor, just check your kidneys are okay, or consume more water because it's a sign of dehydration. This is just general visual for you for what does this look like. So this is your plate. What we want to have is a quarter of your root vegetable and legumes, a quarter protein, a quarter other vegetables, and then a quarter leafy greens or salads. If you stick to that rule, if you're able to eat these foods, because again, some of you might have to restrict your fiber intake or something, it doesn't matter how big your plate is. If you need to have small portions, you just want this ratio of foods, and then you're pretty much going to be hitting your nutritional intake needs. I hope that's big enough for you to see. And then I'm going to really quickly go through supplementation, because we don't have science for supplementation. So we cannot say certain supplements are going to help you. But what we do know is that clinically, and also doctors, we're sort of all on the same page of this, is for a reason that we're yet to discover, it appears that people with EDS do have a higher need for magnesium, vitamin D, B6, B12 and vitamin C. Quite likely because our absorption isn't very good, and it goes back to what's happening in our gastrointestinal tract with those tight junctions. And it might also be that you're not able to eat enough food that's got those nutrients in there. With supplementation, I have to say, and spend time to say, that food is your best option for nutrients. If you feel that you might be deficient and you haven't yet spoken to a health professional or doctor about it, please do speak to them before you take anything over the counter, because supplementation can be unsafe. If you take one nutrient, you can bump out another nutrient, the way that our receptors work. And you might be on medication, and some nutrients might stop your medication working as well as the doctor would want it to. And then getting a test to know what your levels are is the best way to go forward, and then you know the dose you need. And then you then figure out, oh, I might be deficient in, say, vitamin D, and then you look at maybe the causality, and then addressed so that you don't have to take supplementation for a long time. And then these are issues that arise that we're going to discuss. Common questions I get in clinic that I would expect maybe some of you have as well is, you know, you feel you feel full after eating proteins. You might feel sleepy after eating carbohydrates, have reflux, bloating. Shouldn't I eliminate foods? And there's a plethora of advice out there and you're confused. So these are aspects of nutritional needs for EDS that I think is very commonplace for people. So we're going to have a good old chat about it. So I've whizzed through, I have run over because I do talk a lot. So over to any questions, if anybody wants to ask anything, wants me to recap anything I've garbled at them, show a diagram again.
I'd like to say, first of all, thank you so much, Lorna. It was so informative and important and complex, but we are complex creatures. There was a recurring question that people have regarding the balance between carbohydrates and proteins, or more specifically, the amount of proteins we need. And there is a recommendation here we have for increasing the amount of proteins. And first of all, I didn't see that in your slides. And another question is, if we increase the protein because maybe we need more proteins, how does that work out with dysmotility and everything our intestines needs to like process correctly?
Yes, it's a fantastic question. I didn't specifically put it in the presentation because there's such a wide parameter of the whys and the why nots in that. So protein, when we talk about protein, it's important to remember what is protein, and it's actually your amino acids that are essential for building blocks. And it's, you know, you've got like lysine is from milk, or whey protein if you have a supplemental powder. You've got your legumes will have protein in, but you will need to mix your types of protein to make sure you have complete amino acids. So it depends if the audience are meat eaters or plant-based when we talk about the protein quantities. If you're solely plant-based, you will have to actually eat a higher amount, like grams, in one meal for the amount of protein to be utilized by the body compared to, say, a lean meat. It's a lot more work for the body to break down those plant-based proteins. So it's quite hard to give a very generic answer to without knowing the protein source someone might be having and why they might have been recommended to have a higher need. Generally, we're looking at sort of if someone in clinic is having a 20-gram portion of protein, that's like amazing. We don't need more than that because your body can only do so much with protein at at one time. So if you've been told by your doctors or a dietitian or nutritionist that your personal need is higher, but you're struggling to get that in because protein is really great for satiety, so that feeling of being satisfied and fullness. And you might hear, you know, on general media and people talk that feel fuller for longer, have more protein. That's fantastic if you don't have slow emptying tummy, because it's going to sit there for ages. So really, we don't necessarily want to be powering up our protein intake in one meal. We want to be choosing the right type of protein that's easy to digest. So we might go in with some white fish or white chicken or tofu, rather than a big old bowl of black beans or lentils, which, you know, that's high carbohydrate fiber, which is super good for us, but it's going to take us a long time to digest and extrapolate the proteins. So choose your protein source that's going to give you the biggest bang for your buck, so to speak. Ensure that you eat that protein first over your carbohydrates. Yes, fiber's good. Yes, carbohydrates needed. But if somebody has been told by their healthcare practitioner that they need more protein, they should prioritize it so they don't get too full and then they can't fit it. Without enough protein in our bodies, we don't have the building blocks to regenerate new tissue. When we were looking at that diagram of the digestive tract, that is all our amino acids are regenerating every day for that nice structure and that muscle movement. But it's it's quite a difficult general topic in terms of people's personal intake. Does that make sense?
Yeah, sure.
So one tip is someone struggling to meet their protein. Obviously, if you've been directed by your healthcare practitioner, go back and speak to them and see what you can do. But using a supplemental powder is safe for most people, and it's really easily absorbed because you've got it suspended in the liquid, which is going to empty through your stomach quicker. And so that's a good way of getting more protein in. Does that answer the question fully for you?
Yeah, I think perfectly. Thank you. By the way, you can stop your screen sharing, and then
happy face.
see better. I invite anyone who is with his or her camera off to turn it on, so we can have like a more intimate talk. See you are with us. I see a question from on the chat. I'll wait for you to stop your screen.
There we go. I couldn't get out of my.
So there is a question from Anat regarding the sugars you mentioned.
Yeah.
Anat asks, so it's better to eat white sugar than maple and date syrup? This was when you, yeah.
Thank you for the question. I mean, you could do an hour talking about types of sugar and how they work in the gastric. So we don't want those sugary substitutes, but maple syrup, honey as well, they are formed of just sugar. So if you look at the molecules, it will be the same. So just stay away from the things. If you have gastrointestinal involvement. If you have no problems with your gut, it's probably not going to impact you too much. But if you do, then you might fare better from staying away from those stevias, aspartame, etc., and go for what we sort of class as more pure sugars. So just sugar or maple syrup or honey. So I hope that clarifies.
Anat, does that answer your question? Good. Okay, so another question is from Ravital. She asks, just a minute. Is there such a thing as an absorption study? Blood work will only show long-term changes, usually in mineral and vitamin intake.
So do you mean absorption study as in a testing that you have, or a study as in research papers?
Good question. Maybe you can, Ravital, clarify what you meant.
I mean personal testing, because if they say you're low in vitamin D, for example, you take it for 6 months to a year and then they will only blood test you again, but there's no way of knowing whether you're actually improving along the way.
Yes, yeah. So it's a tricky one. If you've had a blood test and it shows you're deficient and you go on whatever your protocol is to correct that deficiency, you're sort of head in the clouds of hoping unless you're retested. In my clinic, if someone, I obviously do a lot of testing, but if someone comes into my clinic and they're already have been diagnosed as a deficiency, let's use the example of B12, and then they have their medical approach to either injections or tablets or some extreme cases IV, then the doctor will take charge of retesting at a suitable time to check it's worked. In my clinic, I will also repeat bloods, ideally about 3 months' time. If you feel that it should be symptom related. So we know the symptoms that occur when you are vitamin D deficient, vitamin B deficient, magnesium deficient, iron deficient. So if you start supplementing and your symptoms have not changed, then it's important to A, retest, and then B, look at potentially you're not absorbing those nutrients. Supplementation is quite tricky to make sure that you have the right form to make sure you're absorbing. If you have an issue in your intestines where you're not absorbing the nutrients from your food, let's for example take iron, and let's assume that you are eating red meat, so the iron you're eating is heme iron, which is far more bioavailable than non-heme iron in plant sources like your beans. If you're deficient and you're consuming that intake of vitamin through food, then we look at maybe you're not going to be absorbing your supplement. So we would be looking at a liquid supplement, sometimes transdermal supplementation, or in extreme cases, you would need to speak to your doctor about a more medical approach like the IVs or the injections, and then retest. So I hope that answers your question. I realize it's a long-winded one because it's a fantastic question, but it's actually a long process. And the upshot is, if your symptoms have not improved, and if you know that you're not absorbing nutrients, then there isn't necessarily a test to check you are absorbing your nutrients, other than doing bloods again and organic acid tests, because if you aren't absorbing well, you'll be excreting waste in your urine. And so we can look at what's called a dried urine test. Bloods are the gold standard though, and I'm not sure what you have accessible in Israel in terms of those dried urines. So I can't comment in your country, I'm afraid, of your testing. So I should have had time to look that up. I do apologize. So I hope that answers your question.
It did, thank you.
Perfect.
Great. There's another question here regarding magnesium. I can't see who asked this. The username is iPad. So iPad asks about being recommended to take magnesium for cramps and constipation, but it causes cramps and very soft stool.
Yeah. So magnesium is a really interesting topic. I mean, honestly, you could do an hour's talk on magnesium. When people say you should take magnesium, it's like, okay, A, what for? And B, what substrate? So magnesium has a few different substrates. There's oxide, malate, and citrate, and glycinate. Depending on why you need to take it is what one you will have. If you have general fatigue, a little bit of muscle ache, you might be taking a combination. If specifically you're being suggested, obviously, hopefully by a healthcare professional or doctor, you're being suggested to take magnesium for constipation, then you'd be taking citrate or glycinate together. And that will literally draw fluid in, soften the stools, and it also, magnesium relaxes muscle motility. So if you've got anything in that lovely gastrointestinal tract that we looked at in our images, if the motility down is A, slow, or B, not complete, so the squeezes of the muscles aren't well, or you have cramps and you're not evacuating your bowel and you're constipated, magnesium can relax those muscles and speed up the process. So if you're not constipated, but you have muscle fatigue or aches, and you take the wrong type of magnesium compound, you're going to just have loose stools. So it can work as a laxative. So it's about matching the type of magnesium supplement to why you need to take it, and then the dose specific. So, I didn't put in my presentation anything like doses because everything's, personalized. We know that around 300 milligrams of a combined substrate magnesium is helpful for most people, but it depends where you are. If you've got loose stools, you do not want to take that. If you've got muscle twitches, then you might want to take a higher amount if you're constipated. So I hope that answers your question.
It sounds like it. I think we have time for maybe one or two more questions. So another question from the chat is, what can you say about the relationship between a day of exertion, as the question reads, like lots of exercise or activity, and the feeling of my gut tract shutting down, which can take days to come back to regular activity and work? Right.
So from what I understand, the question is like high exercise during the day or just high activity, so you're on the go a lot.
Exertion, a day of exertion.
So it's interesting, if that exertion is, say, just 2 hours you've gone to the gym and you've worked way harder than what your body can maybe recover from, then your gut, don't forget, is the core of your being. It's linked to your brain, and your body is very sophisticated in saying, oh, you've overdone it a little bit now. We need to slow everything down. It's a stress response. And so quite likely your gut will just, I'm not going to say stop working, because it's not going to not work, but it will severely slow down because it's in a stress phase, or maybe in a stress phase, and your body needs to recoup its energy for its muscles. But if you're talking about just a busy day at work and it's not an isolated exertion of, a gym session or climbed a mountain, if it's just general day, that might be indicative of not having enough food going into your body to sustain your activity and having some nutrient deficiencies. So you might not have enough nutrients to pull for that energy metabolism. Also, your gut bacteria that's in control of energy regulation and your metabolism. It's a whole complex called ATP citrate cycle of literally how your body uses energy. So you need to sort of look at what's going on with your gut and with your stress, and isolating for you any symptoms that you feel. So keeping a symptom diary would be really helpful with your exercise or your exertion, because I don't know exactly what what your exertion is. It's hard to answer, but generally it would be a sign that, there's something going on in your body that could be better. So more fuel, certain nutrients, or more rest is needed before the event.
Okay, I hope that's clear. I think this will be our last question because we will need to wrap it up. What can you say about a situation when eating and vomiting everything I eat is coming out in vomiting?
So if you're consuming your food and you're vomiting straight away, if you remember back to the image of the gastric emptying and that timeline, if you're vomiting before that 20 minutes, 30 minutes when your stomach should start emptying, then you know that that food is coming from your stomach rather than coming up. Excuse me. If you've eaten your food and you're bringing it up and it's complete, so it's not yet liquidy, like if you can literally see food particles, that would be a call to go to your doctor, explain what's going on. And because I can't see who asked the question, I'm afraid, but I'd hope that you do have contact with your medical doctor, and that if you have already asked and it's not been addressed, go for a second opinion. Because yes, there's so much we know about everything we've discussed in this presentation, but there's certain things, if we go to what was in the functional gastrointestinal, when I mentioned about biomechanical or physiological mechanical dysfunction, that could be an area for you. I'm not going to say it is because I'm not a doctor, but it might be that you've got something mechanical that needs to be addressed, because yes, you should not be vomiting your food after you eat. So I hope that explains.
Great, thank you. Thank you so much. It's been really so great having you, so informative, so reassuring to know there is information. People are asking, and I hope you can answer, how can they contact you and get a consultants?
Yeah, so I welcome anyone to come into my clinic. I will put it out that if anybody has kidney dysfunction, I can't work with kidney disorders, but if you don't, then I'd welcome anyone to email me on lorna@lornaryanhealth.com. I had it on my first slide, and Hila, if anyone didn't have a pen to write that down, please feel free to pass my email address to any of your members.
Okay, so, I'll get your notes on the slide, and we'll pass it on between us.
You can email me. I'm also on Instagram, Lorna Ryan Health, and you can DM me. And if you have any questions that's, a general question that you didn't get the opportunity to ask today, do email. And there's not enough information out there, and I sit with my old patient hat on, knowing how I felt. And so I'm more than happy to answer questions if they're not clinically specific. So if anyone doesn't feel they've had your question answered today, just email me and I'll do my best soon.
Thank you so much for the generosity and giving and open heart from everyone. Thank you.
I just wanted to quickly, before we wrap up, to touch on, I've spoken specifically about gut health, but it is super important to remember that your body is a whole and a multidisciplinary approach. So this is talk to a psychologist or psychotherapist. Make sure you see all the different doctors of all the different body parts. make sure you've got things like good relationship with friends, you know, someone on the end of the phone to have a little good natter to. Do some exercise, have your physio, do your specific Pilates if that's your jam, and just think that you can certainly always get to a better position of health if you think of your body as, you know, a vessel to just soak in anything you throw at it that can positively impact it, and just don't think you're alone. And so the gut is not alone in the body, and you as a body are not alone in the world. So that's what I wanted.
Thank you. That's an extremely important take-home message.
Yeah.
Okay, so thank you everyone for being with us here, and thank you Lorna again, and we wish you all a good night, and we will definitely give you Lorna's email, and thank you all. Good night everyone. We'll finish now.
Thank you very much for having me. Good night.
Good night. Bye-bye.
Bye.